Welcome back to the Pharma Forum podcast. In this episode, I speak with Dr. Samuel Ewing, Global Head of Pharma Partnerships at Doccla. We explore the current landscape of wearable medical devices and the benefits such technology is bringing to both patients and to healthcare systems. From COPD and Parkinson's disease to the danger or otherwise of blood pressure data not being kept private, Samuel calmly walks us through the current state of affairs, how the tech itself has pretty much peaked, but how use can be expanded further, broadening out remote patient monitoring yet more. Tune in, send in your comments if you have any, and, as ever, thank you for listening. Welcome to the Pharma Forum podcast. This is web editor Nicole Raleigh, and today I am speaking with Dr. Samuel Ewing, Global Head of Pharma Partnerships at Doccla. Welcome, Samuel.
Thank you for having me.
So Doccla is a leading European virtual ward provider. They monitor patients in over 13 countries, 10 of which are in Europe, are employed by 30 plus NHS trusts, and are present in over a third of ICBs across the UK. Doccla was founded in 2019 by Martin Ratz after he suffered a heart attack at a young age. His experience of a hospital stay and discharge without any monitoring seemed ridiculous when new technology was available. It was pretty clear to Ratz that there was a need for someone to help patients when they need it most, by using the latest technology to bring them closer to their carers whilst being able to recover safely at home. Subsequently, Ratz partnered with Doccla, who had extensive experience of scaling tech companies, and together with a small team, they won their first UK research project for remote patient monitoring. The rest, as they say, is history. And now, Samuel leads the expansion of Doccla services to provide the global life sciences community with the next generation of digital tools. And today we'll be discussing those digital tools such as wearable medical devices, in addition to remote patient monitoring and digital healthcare. Before we properly begin upon our theme though, Samuel, perhaps you could tell listeners a little more about yourself, about your journey to doing what you do today with Doccla.
Thank you for the introduction, and hello listeners. I'm Sam Ewing, Global Head of Pharma Partnerships at Doccla, and I landed here after 10-15 years of work developing digital health. I started life by developing wearable brain monitoring devices for the continuous monitoring of EEG for epilepsy, before joining Roche Pharmaceuticals in their digital endpoint program, developing technologies and approaches for developing new endpoints for clinical trials, so that we can monitor disease progression, efficacy of drugs, and safety during clinical trials using contemporary technologies such as wearables. From there, I moved to Bioformis to develop the second generation of their cardiac vital signs monitor, which was an upper arm wearable for monitoring medical parameters, before consulting to Capgemini, where I supported the development of Sonova's in-ear heart rate monitoring wearable, which was their entry into the digital health space, before then again moving back to support Roche in developing their digital health solutions for supporting patients on their Alzheimer's therapies. Since then, I've joined Doccla to lead their expansion of their remote patient monitoring and virtual ward technology for applications that we see of high value in the life sciences industry. So that similarly reverts to things like digital endpoints, decentralized clinical trials, and advanced patient support programs to support patients on therapies after a molecule launches.
Gosh, thank you for that. I mean, as you say, you've clearly played a pivotal role in the development of wearable medical devices and associated software ecosystems across a whole range of health conditions there, Samuel. I know also that you did have involvement in one for COVID, is that correct?
Yes, the Varion device, which we were developing at Bioformis, was used to monitor patients during the COVID pandemic. That was deployed in Singapore for monitoring COVID patients.
So thinking about these wearable medical devices, can you maybe provide for listeners some insights into the general evolution of wearable technology and how and why they have such an impact or potential impact on healthcare and patient outcomes?
Wearables now go back decades, and it's really hinges on the opportunity to measure a number of different physiological variables using a number of sensors, which are actually small enough that we can talk about them all in a single podcast. So we only have a couple of primary mechanisms for measuring things using wearables. That'll be optical sensing, which is what drives the lion's share of wearable devices. I think nearly all of the ones I've developed have been using optical sensing, which allows you to effectively measure what's going on in the cardiovascular system. And that's what underpins all of the devices that many of the listeners will have themselves in the consumer space. Things like Fitbits and Garmin devices are all using that optical method for getting at things like heart rate variability. People are progressing the algorithms to this point where it's looking likely in the next 6-12 months that we'll see a lot of blood pressure, continuous blood pressure monitoring devices based on optical sensing technologies. And this allows us to get a very distinct set of variables that are very high interest in delivering healthcare. And they're the 5 primary vital signs: temperature, heart rate, respiration rate, blood pressure, and oxygen saturation are things that are measured routinely in hospitals all around the world. And it's something that can be transitioned into a wearable very easily. The other measurement domain that is of interest is electrographic, and that's for things like ECG devices, EEG devices, and that's measuring the electrical activity of things like the heart, the brain, muscles. They are less common. You'll see ECG sensors in things like most current versions of the Apple Watch, and we are seeing ECG creeping into the wearable space. And that gives you a very similar readout as you see with things like optical devices, where you get more sensitivity, so you can get at things like heart failure and atrial fibrillation, which all sounds great. That's kind of it, though. There is a limited subset of things you can measure about humans from wearables, and a lot of it hinges back on the cardiovascular system. So you see a lot of value and use for these in cardiometabolic disorders, oncology. Where things get a lot more difficult, is where we did a lot of work at Roche, is when you go into things like the neurosciences. It's very hard to measure problems with mental health, brain disorders. There's a lot of short story. There's loads of things that we can measure, and Doccla are working on those to bring those to remote patient monitoring in healthcare and life science spaces. There's also loads of things that's actually really difficult to measure. I think it's very easy, and I meet a lot of people who think that wearables can solve all problems in medicine, and that's certainly not true. Wearables can solve a small subset of problems in medicine and improve a small subset of processes. There's still a lot of things that you can't do at home.
So if we think about that subset, as you termed it, and just come back to, let's call it a sort of true value, true benefit for patients, for healthcare systems, what role are wearables literally playing? Let's spell it out for listeners. What benefit does it bring to a patient wearing a wearable for whichever condition they're suffering from?
I mean, simply put, it allows them to be monitored at home. And a case in point, Doccla are doing a very important piece of work in COPD, which is a major driver of acute admissions for the NHS in the UK. I think it's estimated something like 25% of emergency admissions during the winter period are down to exacerbations of patients with COPD. We actually provide a system for monitoring COPD at home so that we can keep an eye on patients. We know what their current health status is, and our remote clinicians are able to advise those patients on whether they actually need to attend an emergency department during an exacerbation. And most times it's not true. These patients, what they need clinical reassurance. They don't need to be in a hospital. And with that work that's ongoing, we expect to see a significant reduction of the number of admissions of those patients, which, if it's as effective as we expect it to be, we could be reducing those emergency admissions just in COPD, which has is accounting for 25% of admissions in the UK. And that's just in one disease area. That approach extrapolates across other diseases where it's possible to provide that level of monitoring and provide that level of support to patients, that you can reduce admissions and get patients out of hospital quicker, which is reducing burdens on healthcare systems and enabling the clinicians who are working in those hospitals to be focusing on the patients who really, really need to be there.
Yes, thank you for that. So it's clear that you have great expertise in remote patient monitoring and digital healthcare, from what I've heard today and previously also. But I note also when you were at Roche, you managed remote patient monitoring across various diseases such as Parkinson's, Huntington's, Alzheimer's, multiple sclerosis, really complex conditions. So I just wondered, when it comes to these and digital biomarkers and decentralized clinical trials, and when I say these, I mean remote patient monitoring and digital healthcare, can you perhaps share for listeners how overall, so if we come and broaden out from wearables, how is technology transforming healthcare for today and for tomorrow? And what are these technologies facing when it comes to challenges as well as opportunities?
They're really interesting indications to try and work in, and we're really still in a very nascent stage. So monitoring diseases, as I indicated in the neuroscience, and things like Parkinson's, Huntington's, it's really very, very difficult. And the work we were doing at Roche was to attempt to establish new endpoints and new ways of measuring those diseases so that you could demonstrate the drugs that were being used in those clinical trials were efficacious. If we take a case in point, the Parkinson's example you mentioned, current best practice for that is to provide a in-clinic assessment called the UDPRS. Don't ask me to tell you what that abbreviation stands for. And that involves a doctor observing a patient, asking them to perform specific activities, and then it's scored, on a scale of like 0 to 5. So you've got this incredibly gross scale of trying to measure someone's disease status. And it can be horribly inaccurate when you've only got 5 options to choose from in determining someone's status on a specific item in a questionnaire. Then the sensitivity of your measurement only has 5 buckets. So it's actually very difficult to determine if someone's moved from, say, a 3 to a 4 on a specific point in the scale, because the size of the bucket is just very, very large. And so we were developing mobile applications to monitor things, A, more frequently, and B, much more sensitively. So in Parkinson, a standard symptom is tremor. So you can ask people to hold a smartphone in a certain position, and you can use the accelerometers and gyroscopes inside the smartphone to measure that tremor. And by deploying it on a smartphone, you can do that in someone's home. You can ask them to make that measurement daily, rather than having something that's measured once every 6 months. So you start to see disease progression on a day-by-day scale rather than seeing a patient maybe twice a year. And that measurement is also very, very sensitive. You can measure that tremor. You can measure it when a human eye can't see it. And so you're actually able to pick things up earlier because your measurements are more sensitive. And that's just one measurement that we were developing. At Roche, there's a large number, and a lot of these studies we were putting in 8, 9, 10 experimental approaches to try and determine what the best way to measure these things was so that we could develop new endpoints. And that's work that is ongoing across a number of pharmas, a number of private institutions who are all trying to work out the best ways to measure disease status and disease progression. And frankly, we're still nowhere near it. There's an awful lot of work to do. Technologies continue to mature, and that is work that we're all trying to drive forward.
Yes, I mean, again and again, this word measure or measurements. When we think of measurements and technology, we have to think also of data. And you hear so frequently lately that there's a glut of data, a mountain of data, if you will. So when we think about remote monitoring and we think about that real world data that's being gathered, giving insights into the status of a disease, the progression of a disease, what are the challenges there with management of that data?
I'm not sure challenges is the right word. I think a lot of people think that managing data is very complex. And I'm sure some of our listeners will disagree, but I think we're fortunate to have a lot of regulation around the management of this data. Broadly speaking, it's entirely defined what we have to do with this data. If we go back 10 years, then none of these regulations existed. And so there was effectively a bit of a mess because everyone had a different way of doing things. Whereas now, things are so tightly controlled that we know exactly what we have to do with the data and just have to follow processes and implement things. To a great extent, I believe that there is a little too much sort of hysteria around data management. It's not that difficult. There's, frankly, a little bit too much concern about things like privacy. We do have to do an awful lot of work in protecting. Obviously, we need to protect patients' identity. But at the same time, if somebody knows my blood pressure, the risk of that data being available to people is not as high as people like to think it is.
The risk of the blood pressure information?
The risks, to my mind, the risks don't exist. So we put an awful lot of risk management in place to manage risks that aren't realistic. So the idea that someone might know a patient's blood pressure or their heart rate it's just not as terrifying as I think that the media would like to have us believe.
It's a valid point. We like to spark conversations on this podcast. So if there are listeners out there who disagree with Samuel, please do let us know, and we can perhaps have a a roundtable discussion on this, but I see absolutely where you're going, Samuel. So lastly, let's think of tomorrow's then. So the future, it's been gathering momentum, this space. All things considered, where do you want and where do you see the horizon being and going in terms of everything that we've been discussing today, in terms of everything that you've seen and experienced in the space in which you work with at Doccla and before?
I think we will continue on the trajectory that we're on, just more slowly than everybody expects to, obviously. And so we're very close to reaching a point where the technology can't really improve much beyond where it already is. In terms of the actual interface of devices and the human beings that are wearing of them, not much can really change there. The optical sensing devices that we have, the electrographing signals devices that we have, they're about as good as we can make them. And with that maturity, I think we'll start to see an improvement in the adoption of the processes of monitoring these things with these wearables. I think one of the things that's held us back over 10 or so years is that the technology itself has continued to progress. And I think clinicians have quite rightly thought, well, this is changing all the time. Do we engage in this now or do we wait? And I think the option has been to wait, which was probably the right answer. We're now at a point where these devices are so mature that I think we can all agree that the measurements are reliable and they will remain reliable. And we will not see significant changes in the way that we capture them as we move forward. And with that stability in the technology, we can really start to think about how we process that data to get the most out of it. And so we can't possibly leave a podcast without saying AI. But I mean, we're back into a space where it's going to be the algorithms that are really important. And that's where we're going to see I think huge leaps forward, and that's going to generate this these new digital endpoints, digital biomarkers where I say at the moment, there's lots of things that we don't understand, but there's lots of things that we can measure. And with the algorithms that it's now possible to create with stable data sets, I think we'll see an explosion of new endpoints and ways of understanding disease progression, and drug efficacy. I think all of that will come, but medicine is a very slow moving beast. And it will certainly take longer than another 10 years.
As you say, a maturity into optimization. Thank you very much, Samuel. It's been a pleasure.
Thank you.
And so that concludes another episode of the Pharma Forum podcast. You can find more information about this episode, including a download link and information about previous installments at pharmaforum.com/podcasts. The Pharma Forum podcast is also available on iTunes, Spotify, Amazon Music, Podbean, and pretty much wherever you get your other podcasts. Just search for Pharma Forum and press subscribe. Of course, don't forget to visit our website itself, where you can sign up for daily and weekly news and analysis bulletins. And do follow us as well on X or Twitter and LinkedIn at Pharma Forum. That's all for now. Thank you for listening.